Good afternoon, Dzień dobry, and welcome to another installment of the Road to Cybersec 2020 Task Force meeting series. I hope everyone is staying safe, and just as importantly, I hope everyone is staying healthy. The Kosciuszko Institute, in partnership with the British Embassy in Warsaw, has brought together an amazing panel to discuss tackling cybersecurity challenges during the pandemic in the fields of healthcare and the financial sectors. I just want to say, before I introduce the panelists, I'm just going to go over a couple of housekeeping items for all the attendees who are listening in. Again, welcome. Today's webinar is an hour and a half. By design, the attendees' microphones and cameras are muted. However, if you have a question, you're able to use the Q&A chat box to ask questions during the panel. I will try to curate as best as possible and to incorporate those questions in during the discussion. And if we have time at the end specifically, I'll pull out some questions and we'll do a little round robin of questions of Q&A. I'm going to introduce all our panelists. I'm going to give a little small disclaimer. Since all our panelists are very distinguished and they also have very extensive careers in cyber and information security, I'm going to do the abridged version of their bios today, so I apologize in advance. I don't want to take away from, again, their lengthy bios, but for the sake of time, so we can get into the discussion, I'm going to do a little more brief. I'm going to go alphabetically, so it just happens that I'm going to start with Mr. Andrew Fitzmaurice, who is the Chief Executive Officer at Templar Executive. Mr. Fitzmaurice specializes in government and commercial sector board level engagements and transformational change programs to enhance business performance. Mr. Fitzmaurice has worked in the Cabinet Office, where he set up and ran the Office of the Government's Senior Information Risk Owner. And Mr. Fitzmaurice has also established the Templar Cyber Academy, whose range of courses and training are uniquely certified by GCHQ, IISP, and BCS. Welcome.
Thank you very much.
Next,
I was abridged.
It was abridged. Mr. Miroslav Mai, the former president of the Cybersecurity Foundation and a former leader of CERT Polska team. Mr. Mai was the advisor to the Minister of National Defense Polska on planning cyber defense capabilities and building organizational structures, as well as establishing international cooperation on the field of cyber defense. He is also the member of the Trusted Introducer team, which was responsible for accreditation and certification of certs. Mr. Mai, welcome. Mr. Cezary Piekarski, who is a managing director and global head of cyber defense and threat management at Standard Chartered. Mr. Piekarski is responsible for defensive networks, servers, and endpoints across the bank, with a particular focus on a phishing attack response. Additionally, Mr. Piekarski leads the Polish Cybersecurity Competence Center for the bank. Welcome, Mr. Piekarski.
Hey, thanks for having me.
Mr. Sean Sutton is a partner at PwC UK, specializing in cybersecurity. Mr. Sutton advises clients on topics ranging from security strategy and organizational design to technical security solution design, delivery, and implementation. Mr. Sutton has led some of the UK's largest security transformation programs, including multi-million-pound capability enhancement for oil and gas, utilities, energy, pharma, and financial service organizations. Recently, Mr. Sutton led PwC's COVID-19 response, advising clients on how to respond to threats arising from recent disruption and to remain secure. Welcome, Mr. Sutton.
Thank you.
Dr. Magdalena Josek is head of the Strategic Analysis and Emerging Technologies team at National Research Institute. Dr. Josek is responsible for strategic, regulatory, and organizational issues related to cybersecurity and the development of emerging technologies. Previously, Dr. Josek worked at the Ministry of Digital Affairs, where she was responsible, among others, for negotiating the NIS directive and coordinating Cyber Europe exercises. Welcome, Dr. Josek. And myself as the moderator, my name is Aaron Ostrovsky. I'm an expert from the Kosciuszko Institute. I'm very happy to be here, and again, I'm very happy to hold this panel with such a great list of panelists. So welcome, everyone. And again, I apologize for the abridged version, but I want to keep the conversation going. Before I start to lay the framework of why we're talking about specifically healthcare and finance, I wanted to lay the landscape a little bit, and I promise my goal with these figures that I'm about to present it's not really to depress everybody this afternoon, but I think it's important to quickly paint a picture of the global landscape. So as of earlier this week, we have 16+ million confirmed COVID cases across the globe, about 600,000 plus confirmed deaths, and 216 countries, areas, or territories with cases. The global economy by the World Bank is forecasted by the World Bank to shrink by 5.2% this year. According to the International Labour Organization, COVID-19 is expected to wipe out 6.7% of working hours globally in the second quarter of this year. It's about equivalent of 195 million jobs worldwide. By the end of 2020, this is in the context of the United States, the Global Workplace Analytics estimates that due in part to COVID-19, 25 to 30% of the US workforce will be working from home multiple days a week. I'm sure that is something that is very similar in other countries, maybe not the percentages, but the idea of working remotely. And COVID-19 inspired malware saw the highest jump across the globe, with 92% noting an increase in such threats compared to typical volumes before the outbreak. This is according to ZDNet. Again, I'm sure there are other figures. I think there will be more to come as it relates to figures as over time we start to examine this period of history. That's just, again, some of the numbers. Again, I apologize in the afternoon to bring a little depressing figures, but I thought it was helpful in the backdrop as we start to talk about healthcare and the financial services, or specifically financial sector, some of those figures as it relates to what's going on with the pandemic, what are we talking about in terms of employment, and what are we even talking about in terms of just general cybersecurity and cyber threats, and what that really means across those two sectors. With the ongoing health crisis or the pandemic, this has obviously changed our lives in an unprecedented way. Various sectors are adjusting to the new reality, but two of them remain debatably maybe a little more affected than the others, healthcare for sure, and finance. Both are very critical to society's well-being and functioning, and those sectors have to adapt even more rapidly and efficiently. This pandemic has led really to an accelerated digital transformation in some of those spaces. Again, when we're talking about workforce moving from offices to homes and those types of transformations, lives going online, new deployment of applications, a restructuring for a lot of organizations to adapt to the current pandemic, and to not only to adopt, but to actually function and operationally be able to engage and to thwart the pandemic, whether we're talking from healthcare or we're talking about on the financial side. Again, this is just a little intro. I'm going to start asking just some broad questions just to kick off the panel. These are going to be questions for everybody, and they're very broad to start, and then we're going to drill a little bit into the different sectors, and then at the end, I always like to save the simplest questions for the end. Of course, I'm being probably sarcastic with that because we're going to leave on a little high note, and hopefully there's some positive notions going forward into the future. But I'm going to ask the first question, and then I'm going to go down the list of individuals just to opine and to give their thoughts about both these sectors in the context of cyber and information security. So what are some of the biggest security challenges these industries are facing? I'm going to start with Mr. Fitzmaurice, if that's okay.
Great, yeah, call me Fitz. It's easier that way. Fitzmaurice is a bit of a handful. And yes, that was really quite a depressing set of stats, I think. Yeah. From a healthcare point of view, we've been working with the NHS since WannaCry, specifically to help shore up cybersecurity. And indeed, we found the NHS very willing in terms of its attitude and approach to adopt a proactive stance towards better cybersecurity and better information security. Indeed, we briefed over 3,000 personnel board members over the last 2 years in really understanding how cybersecurity is just a business enabler, and especially around patient care. So that any time at any point a clinician needs to make a decision about a patient, they always have the best information in front of them in the best format for them to make those decisions. And in terms of COVID-19 and when that struck, a lot of the organizations were on a journey to complete this, but obviously COVID-19 completely changed the environment. And just like every other sector, organizations tend to have built their cybersecurity around the physical buildings which they inhabit, and around the policies and processes that govern entry and exit to those buildings. Some home working goes on, but primarily people are expected to be at their place of work. And of course, COVID-19 completely changed that. And overnight in the UK, when lockdown was issued, anybody who wasn't essential services, including large parts of the NHS, had to start working from home. Were we prepared for that? No, we're not. We weren't. And indeed, in some of the equipment that people had, there's actually some really quite interesting anecdotal evidences of laptops which weren't designed to be on for 12 hours a day. And there are some where they actually melted because they overheated and fell apart. It just really wasn't designed. We weren't designed for that. Short periods of time, yes, but for this continuous 3-4 months, no. And if we look at the infrastructure around the UK, so for instance, we happen to have a tool which is very useful to looking at threats and vulnerabilities. And we turn this tool on England. And just in England itself, we discovered about 2.7 million routers which are being used, which are Internet of Things routers, where had fixed passwords and fixed usernames. We discovered that lots of people weren't issued laptops or computers to go home with. They were using what they used at home. So these were computers often used by the family, lots of apps and programs downloaded onto it. Maybe if you're lucky, having your local virus that you may have bought, like Norton and McAfee, others are available to be updated or not to be updated, and sharing it almost with their children. Psychologically as well, people went to be working in an environment where there may be children running around, a lot of families coming to isolate together, not having a proper office environment. And quite a lot, psychologically, that affected quite a lot of people where they would not apply the usual rules and regulations and policies that they would do actually when they were back in the office space. And despite obviously this being a worldwide pandemic, unfortunately, there are always those of nefarious character who will try and obviously exploit this to their own ends. So we saw a massive increase in APTs, advanced persistent threats from state-sponsored countries, obviously serious organized crime. But the biggest increase we noticed was actually in script kiddies. Those young teenagers who were bored, nothing to do. And we saw a 3,000% increase in the UK by script kiddies attempting to disrupt people's operations. And of course, what's happened is that we've taken that those operations based around physical entities and stretched out the information flows back into people's homes. But not only those prime organizations, we talk about trust, but so had all their suppliers done the same. So you can see how the risk within the ecosystem had really largely increased. And of course, added to that, the government, the UK government especially, have put in around about £190 billion into helping organizations sustain themselves through this period of COVID, through furlough and other schemes. So there's a lot of money floating around. There's a lot of money which people would want to access. So we haven't seen too many attacks centrally like the famous WannaCry ransomware that we had, but we have seen a lot of COVID-related scams. And I believe the figures at the moment for the States, around about $77 million have been lost through COVID scams. And the UK, it's around about 36 million. But because of these stretched services, there is a view that actually one of the government committees said it could be anywhere between 1.3 billion up to 7.9 billion pounds will be lost by the end of COVID to fraud and error, because we just stretched all these lines of services and support. And, you know, people, unfortunately, around COVID have a very emotional response. And so the bad guys really took advantage of that. There's the emotional piece. We saw so many scams about giving money, supporting the NHS, which weren't those. And a lot of elderly people gave a lot of money towards that. So we had that emotional. Then you had the fear bit about saying, well, you need to get PPE. By the way, you know, in the States, famously, drink this disinfectant and you'll be cured. You know, there was a whole sort of range of stuff. Some of it so stupid and unbelievable, but people actually did fall through that. So you have those real sort of two factors, and you have the compassion, where people want to give money to support organizations and ensure that, you know, the country came together to do its best. And the amount of fake scams have just been absolutely enormous. So whilst we haven't seen, and this was really up until just recently, we hadn't seen too many central attacks against trusts themselves. But then the added factor of searching for a vaccine came into play. And once that came into play, we saw a different level of state intervention in terms of what's been widely publicized in the UK, difficulties perhaps with Russia and China, in terms of people wishing to get ahead with the vaccines. Now, one of the areas where we have found it difficulty, and it's with sort of academics and academic research, which tends to not think badly of people who collaborate. And we have come across some really interesting collaboration going on with countries which plainly have a different agenda. And perhaps academics don't understand that state will sometimes interfere in their work to actually use it for a state benefit as opposed for academic and research. So I think on the health side, we've adapted things like social media, like WhatsApp and others, to actually fill a gap and to help secure that extended service and supply line. But it's not the answer going forward. And indeed, our information commissioner under GDPR has sort of given everybody a little bit of a loose rein over what information flows over what types of systems. But that will not last forever. And some people again have misused this, and there will be some legal cases coming out of COVID where indeed medical people have misused information or spread information. A famous case in the paper was about our own Prime Minister, where his conditions were actually shared on a WhatsApp group, which was highly inappropriate and goes against all the ethics of patient confidentiality. So all that comes into the mix as well. On the financial side, well, who uses cash anymore? Nobody will even wants to touch it because they feel it may have COVID on it. And of course, the banks have increased the ability for credit cards to pay from the UK from £30 to 45. So people making sort of modest shops can afford not to touch anything and move it away. And again, COVID has corralled us all onto a meeting like this on this type of platform. But all our business is done on this type of platform. And one of the great winners has been Amazon in the UK, who, of course, everybody's been ordering Amazon stuff left, right, and center because, again, you know, you can't get out, you can't get to the shops. To have it delivered to your door is hugely convenient. But again, it takes the use of companies like PayPal and others. And again, these are obviously targets for fake scams, fake sites, fake usage. So again, whilst there hasn't been an increase per se on attacks on the main banks who have a very good system, and many of them, by the way, already did adopt home working, but there has been on sort of the delivery, the endpoint element, where people are trying to be spoofed into believing a site belongs to Barclays, isn't actually Barclays. And so I think it's been quite a challenging time on both sets and both fronts, and I still think there's quite a way to go yet as we move forward into this hybrid way of working, where we have some people back in the office, some people working from home. And to quote a phrase from a colleague of mine, COVID was the best digital officer who we never paid for, because they have really pushed the digital agenda. We've had no choice. In fact, we had no choice but to adopt the digital agenda. But many of us in the cybersecurity world are worried that whilst we utilize this fantastic new way of communication, we haven't enwrapped it in good cybersecurity. And that is a worry both in the health service and in the financial and in every sector, in fact.
Thank you. That was very informative, very good intro. I'm actually going to turn it over to Mr. Sutton to why we stay on the British front, because I think it's interesting to stay in the context right now. So I'm going to ask Mr. Sutton if same question again, or if you want to expand on obviously a lot of the areas that Mr. Fitz had touched upon. But I think your experience and your insight would also be helpful. And then I'm going to switch to the Polish side and get some insight in terms of, from the Polish perspective, you know, what we were seeing out of Poland. Also turn it over to you, Mr. Sutton. Same question, again, very large question. So
great, thank you. Yeah, I'm not sure we've got enough time really, but I think Andrew covered probably all of the main points as well. I'm not sure what I can add, but I think, you know, that if I was to reflect on maybe 2 or 3 of the key themes that we saw coming out over the last sort of 3 or 4 months or so, and again, you know, Andrew's touched on a few of these, but I certainly think that a lot of organisations had built security, you know, around the perimeter with the idea that people were largely in an office, and there's always provision for remote working and mobile devices and bring your own devices, etc. There are obviously variances to that, but broadly, I would say most organisations still thought in terms of big walls, whether it was around their own infrastructure, whether it was around cloud provided infrastructure, but the expectation was still there. And almost overnight, many organizations were turned inside out. So suddenly all of your users were everywhere except where you'd built in a lot of your security and a lot of your control. And that became, I think, quite an acute problem, certainly within financial services around call centers, for example, where you've got lots of controls that are perhaps more orientated to physical check as well as cyber. So making sure that your colleague next to you is not necessarily writing down credit card information on a piece of paper, for example. So lots of examples, but also slightly more broadly around GDPR. You know, how are your call center staff making sure that they're protecting customers' information in the right way, and they're not writing down details to help with their job, but then necessarily creating copies of information. So I think there were some interesting use cases that really stood out for me, both within financial services and then some examples I'll come on to in a moment in healthcare. But that sort of concept of building your security to almost overnight have it turned inside out was quite a big challenge. So we've worked with a lot of organizations over the last few months who, through that rapid sort of period of change, whether it's building new infrastructure support, advanced or additional remote working, or whatever it might have been in that space, where they actually had introduced additional vulnerabilities. So they stood up a VPN that was suddenly impacted because it wasn't necessarily configured in the right way or in a secure way. So we've actually seen quite a large uptick in incident response type work, which really reflects, I think, the rapid pace of change that many organizations had to go through to enable themselves to continue to keep working. I think certainly from our threat intel teams tracking the different threat actors that they do, but just more broadly, we have seen in the media some pretty large breaches reported. As with all things, that's probably tip of an iceberg, and many we won't get to hear about. But I think very clear that ransomware really has caused huge problems for many organizations. And if you step back and think about it, that's a lot of that will be down to security culture. You know, you've moved users from an environment they're comfortable in, using technology that they're familiar with, to suddenly asking them to work at home, using maybe new technology, operating in a very different way, with no training, no awareness, no sort of expanse around that culture piece. And it really only takes one user to click something inadvertently, and suddenly you've got a potential breach within your environment. And then when you're actually dealing with a breach, when everybody is remote and you can't coalesce within a war room, or you can't deal with things in the way you might have practiced for years around crisis simulation, well, then you're in a really difficult position. So I think that's really become an acute problem. Lots of interesting anecdotes around machines being taken out of the office, desktop machines plugged in at home while suddenly not working. Some very, I'll say amusing, but amusing is probably not the right word. Some interesting stories where traders needed to work from home but didn't have all of their trading paraphernalia, so needed screens and kit and just all sorts. So, there were some really interesting things that came to the forefront that needed to be solved very, very quickly that you just wouldn't have thought about pre-COVID. And actually, I think on reflection, that's where certainly some of the organizations I'm working with at the moment they're looking at, what have we learned? What's the return to work? What do we want to replicate and actually make ourselves better at doing in the future? What do we want to avoid? And that's really calling into question, I think, some of the bigger decisions around, do we go to cloud? Do we use different platforms to facilitate co-working when everyone's remote? So there's some really interesting big architectural business decisions that I think are being assessed at the moment. And I think if we look back to WannaCry, that caused a huge impact at the time. Thankfully, we haven't seen anything similar. But without a shadow of a doubt, there is a lot more focus on organizations across the health sector, both in terms of those that are working on potential cures. We've seen, very recently, again, a breach across one institution within the US that happens to provide a lot of service or a type of system to UK universities and potentially more broadly. That clearly is something that potentially now could target work that the likes of Oxford or others are working on. So, at a time when we all need to pull together and really, try and find solutions, it's very difficult for organizations to have to contend with malicious intent. COVID's impacting everybody, whether you're a cyber hacker or not. So you would think that at this sort of time you would see less of a focus, but the reverse is certainly seeming to be the case. I'll pause there. It'd be interesting to get, I think, some perspective from overseas as well.
So I'm gonna go. Thank you for that, Mr. Sun. I'm gonna switch over to Mr. Pekarsky, but I'm gonna take the original question. I'm gonna tweak it a little bit based on the conversation that we've been having so far. It's still in the same theme, but one area really is about how did COVID-19 challenge preparedness and operational resilience. So I think we've talked about some changes in terms of what it means to modernize some infrastructure, whether that's going, from on-prem to a cloud solution or a hybrid form of that. But ultimately, even talking about operational resilience, what changes had needed to be made operationally to enable to continue businesses to still function, whether we're talking on the financial side, we'll keep it in the context for this, but also within the hospitals and the healthcare organizations, which again, at the same time of trying to keep doors open, they're also flooded with patients, with very sick patients outside of just general taking care. So I'm tweaking the question a little bit, but it's on the same theme based on what we've heard so far from Mr. Fitz and Mr. Sutton. So Mr. Pekarsky, I was curious if you could talk a little bit about what you saw maybe in general in terms of, companies being challenged with some preparedness and just general operational resilience, and, supply chain is a good example in terms of supply chain security and gaps in those areas, just as an example. But I'll turn it over to you.
Thanks for a great question and really insightful opinions shared before. I think that we, as an industry, we underestimated the long-term impact of the current situation, and this is where some of the operational challenges really lies, because majority of the financial organizations went well through the initial crisis. So challenges like move from work from office to the hybrid mode in some geographies, or work from home in some other, where obviously they were there, right? So lack of laptops, lack of proper accesses, bandwidth requirements in some of our geographies. There were also another considerations that we needed to factor in related to people movement restrictions and similar limitations. But the bottom line is that the initial hit was quite limited, and in my view, for the totality of the industry, it wasn't really damaging in any way. But as a security industry, what we really missed is that the change that is happening in the technology area is counterintuitive comparing to what you see in other areas, because the overall message is that the impact of COVID-19 on the supply chain will be on the side of shortening the supply chains, making things more local instead of global. And this is the message that is circled around the media and around the professional conversations. While in the technology industry, we are doing something exactly opposite, because we, instead of decreasing the reliance on our third parties, on our supply chain, we increase it by the rapid digitalization. And I made a kind of the bold statement that we missed the real nature of the challenge. So let me elaborate on this. The real nature of the challenge is that all the guerrilla IT that we introduced to the environment as a technology specialist over the last 3 months will need to last, will need to be kept within the organizations, within the current work modes for the next 6, 12, 18, 24 months or longer. And the key challenge for security professionals across the industries, across the geographies now, is to how to secure what we already built, what we built sometimes cutting corners, sometimes when we needed to respond really swiftly, and how to ensure that this will be safe. So in a nutshell, the challenge to supply chain, the challenge to the industry, the challenge to security professionals is much more long-term than the short-term. It's very different to what we initially thought it will be.
Thank you. Just taking notes. Very helpful. Thank you. I'm gonna go over to Mr. May for the same question. Again, what sort of challenges do we see from COVID-19 as it relates to preparedness and operational resilience? I'm sure there's plenty of examples. I just had mentioned supply chain, but from your experience, what have you been seeing? And if you could elaborate a little bit or expand on some parts of these comments, that would be helpful.
Thank you for the question. First of all, I would like to notice that from my perspective, in my opinion, most cases and most arguments and opinions which we try to express now, it is really much based on our experiences from the first weeks of the pandemic, which is mostly the discussion about March and April this year. My personal opinion is that we try to, as with the physical social distance, try to a little bit rest from this really big effort which we experienced a few months ago, because actually we are almost in about half a year regime. We work like that. Yeah, we collecting the experiences, and we have some problems. So we try to be, maybe together with the holiday time, we try to a little bit rest from the situation. But also my opinion is that we probably are not aware about the old changes, which are ongoing changes, which already were done in the infrastructure, for example, and probably together with the maybe this analogy to the second or third or whatever wave of the pandemic, maybe we will experience, hopefully not, but let's be realistic, we could experience the similar waves with the cybersecurity environment problems. So that's my opinion on that. From my perspective, quite operational, because we also have a chance to work together with many organizations and observe what is ongoing problem in their environments. Probably the big challenge which already influenced us, but also will influence us, in my opinion, again, it is continuing change of the infrastructure. So even that's of course some of our panelists today already mentioned this problem, but from my perspective it is worth to be emphasized, because this change of the IT environment is really significant in terms of many services, many operations, which especially are the main task for cybersecurity teams, like, for example, CISR teams all around the world. So if we will start to be aware about the fact that maybe in the matter of single days, we actually may multiply by hundreds the number of routers which are before our computers. That could maybe illustrate the problem, which, for example, from the perspective of the vulnerability management, monitoring IT infrastructure by security teams in the companies, is a really big challenge. And also from my observation, it is interesting that especially security teams, they were obliged actually, and they feel like their mission to try to work together and actually help to critical services for organizations, for companies, which meant often for them that they should maybe a little bit liberate the security rules, because we needed, for example, to change IT infrastructure, to serve some services, to make accounting in internal accounting for companies, for organizations. So we maybe today we got used to the fact that we work with this new environment, but in my opinion, it will remind ourselves in some time that some things were changed, and maybe not all the rules were adjusted to these changes. So I think now we are maybe in the state of the sort of balance between this fact of liberating some rules and the consequences of it. So in my personal opinion, one of the most important things, and maybe we have a little bit easier time to do it now, for example, is to start some conceptual work within our organization to really understand what we changed during last months, weeks, and what could be the impact of these facts in the near future, which could affect us quite significantly. So that's my opinion.
Serena, very helpful. I think at one point, actually, Mr. Sutter and I were having this conversation. I think what he had outlined actually very eloquently, not on this call, but when we had spoken prior about sort of the phases, not the phases of COVID, but in terms of the phases of how we are handling everything that we're seeing from a security perspective related to the pandemic. But this notion of future and forward thinking and planning and having a moment to breathe to really do, whether we're talking about deep dives or retrospectives, to really understand what changes have we made, whether that's loosening of policy or from a federal or governmental perspective, some sort of reduction in terms of regulations to enable technologies to support, especially on the healthcare side, which we have seen globally. But really understanding those incremental changes. But again, that is something that I'm hoping, and again, this is, thank you, Mr. Sun, for bringing this up, but the notion that once we have an opportunity to forward thinking, really understand what that roadmap looks like for an organization, considering this is something that organizations haven't been through before, and building on the experiences throughout the waves, or not the waves, but throughout the phases themselves. And I'm going to switch over to Dr. Josek. Again, you've heard everybody, so there's probably a lot of items that you've already had.
If you just use my first name, it could be easier for you. Just use the first name.
Okay. And my Polish pronunciation goes a little off, so that's okay. Okay. So similarly, on the same theme, I had mentioned it's sort of preparedness and operational resilience, but also again back to the biggest challenges, security challenges that both healthcare and the financial services have faced and continue to face within this pandemic. What do you see as those large threats? And again, where do we see changes and challenges as it relates to preparedness and operational resilience?
So a lot of has been already said, so I will not repeat this. But the thing I would like to underline at the very beginning is we are kind of lucky that the COVID happened in 2020, not, for example, 5 years ago, because the internet and the network was ready to do it right now. And because of that, we can, for example, meet today and speak about challenges because it was possible to put the whole world online. 5 years ago, it wasn't so easy. The other thing is so-called digital revolution, like everyone is talking about right now. The COVID make it much faster and show us things we were anticipating will happen by a few years' time, right? So the sad truth is not everyone is so happy about working from home. Before COVID, everyone was very excited. Right now, it's not so easy. And very, very sad was also that not many organization was ready to do it. And security by design is still a problem, right? But also the very good thing what happened, in my opinion, and what we also see in NASC was that so-called regular citizens finally understood that the cybersecurity is not a subject connected only for specialists or CEOs of big companies. They realized that the cybersecurity is also their problem because they were forced to work at home, and they finally understood that there could be something which is connected to them as well. So that at the very beginning. Regarding the incident we saw, so it wasn't some kind of new kinds of incident during the COVID. We also saw a lot of scam COVID related, but this is not the new challenge. And also a lot of disinformation about COVID. So I think that was something new. We saw how the new technology can be used to do so much regarding this information about the COVID and health sector. Also, what was proven during the COVID pandemic was the fact that not all sectors are similarly prepared in the cybersecurity, and unfortunately, health sector is the one who is not very good at cybersecurity. That was visible in all the European Union, and that's also the challenge we were facing. But regarding the European scale, I think that the huge challenge we saw was about the privacy also, because a lot of governments were using new technology to track the COVID and track the pandemic. And unfortunately, so colleagues from UK mentioned GDPR before, right? In 2017, we were so proud as Europe to have this new law about data protection. And something like pandemic happened, and suddenly a lot of government forgot that the data protection is actually important, and the citizen are not really happy to give the data for everyone. And I think that this is something that we will face after the pandemic as well. So the subject we thought was already established, the data protection of European citizens, is open again for the negotiation somehow. And the other huge challenge, in my opinion, is that during the pandemic and during the whole conversation about the supply chain and making things more national, we also came back to the discussion about national internets. This was also the subject we were dealing for a long time as the international community, and we had some kind of consensus that the internet will be this open and free for everyone place. And right now there is again discussion about national internet and making internet more connected to the states, which could also be challenging after the pandemic. So that's from me, because I don't really want to repeat what has been said before me.
Well, thank you. It was a great segue. Actually, I want to dive a little deeper into healthcare, since you had brought up some of those components. So healthcare in particular, outside of healthcare organizations, combating the virus itself at a biological level, we saw a lot of rapid deploy technology to assist clinicians and also patients. So whether we're talking about expansion of telemedicine services, home monitor devices for patients from home who don't necessarily need to come into a facility and have additional exposure. And also the notion of enhanced real-time collection of analysis of data, whether we're talking about contact tracing or just general COVID-related data collection. So my question, which you had touched upon a little bit, is around why do we feel that healthcare in particular might be or had been a little underprepared, or even greater than little underprepared for such a digital leap for some of these initiatives, knowing that for some, depending on where you are geographically, that some of these items were initiatives by organizations, but either they were further along or maybe they lost funding around rolling out these types of technologies and services. But I was wondering if you could maybe comment a little bit of your opinion, why you feel maybe that this industry was a little or more than a little underprepared for this digital transformation.
If I may say my opinion on that. Can you hear me? Yeah. Yeah, okay. Yeah, this is quite interesting. I fully agree with what Magda said about the health sector, and we both actually, I guess all of us, we observed how cybersecurity is developing in particular sectors, and I have no doubt that the health sector is unfortunately one of the last one, or one of the lightest on the list. And my opinion is that this is a sort of paradox, because if we are talking about the health sector, for sure we're talking about the consequences which could result in human lives, yeah, and always, and as long as we will build the cybersecurity in this sector and other sector based on the, for example, budget coming for this sector, that will be the same situation, because always there will be easy argument that there are some things more important than cybersecurity in these sectors, like the medical devices, whatever, the same medical devices which will bring to the hospitals the risks which we are aware about, but not the buyers of these medical devices. As long as we will do the same in these sectors, trying to developing the situation in this sector, we have the same situation. And I could raise the paradox opinion and thesis that after the COVID pandemic, if we will not change it, the situation will be even worse. Because for sure there will be more money for this sector, but my guess is that this money will go for another things, not for cybersecurity, because that will be again so easy to argument, it's so easy to prove that there are more important things in this sector than cybersecurity. So coming to the conclusions, my opinion is that we should change the paradigm of developing the cybersecurity in maybe not only the health sector, but this is a good example and easy, I think, to understand, but also maybe for all sectors, especially if we know that there are things which are our common interests, and health, public health is for sure our common, and this pandemic proved this so well, unfortunately, but this is just a matter of fact that we should change the methods which we build the whole idea as a whole project of how to have cybersecurity in particular sector. So for example, money coming from some dedicated budget on the higher level, like state level, for cybersecurity could be a solution. I don't want to say it. I'm sure it is. Yeah, but at least it is worth to consider, I think.
I agree, but I also believe that it could be changing now because of 5G network, for example, and the way the European Union is trying to implement it using, for example, toolbox, a 5G toolbox, to make the network very secure at the very beginning. But regarding the health sector, the problem is, like, so far it wasn't mandatory for them to do anything in the field of cybersecurity. The NIS
because we believe they will do it themselves. Yeah.
Yeah, and the NIS directive was 2016, and it was implemented in member states last year or 2 years ago. 2 years is not enough to be prepared and ready for something like COVID, and to have cyber security in place in the institution like hospital. But also very interesting thing is, like, right now we are in the review of NIS directive, and what COVID did actually was show us how the whole health sector can be affected. So not only hospital, but for example, the pharmacy sector. And right now we have also the huge discussion if this sector should be also part of NIS directive. And so because of that, should mandatory report an incident, which probably will increase the cybersecurity in the whole sector.
I think, if I may, the UK has a really sort of an interesting position on this. I've been fortunate enough to be involved in developing our national strategy since 2007, and we've really tried to expand what we call cybersecurity, the definition, and I think that's really important. So post WannaCry, instead of just concentrating on technical solutions, we looked at that integrated solution. So we came across a number of boards who had never even spoken to the IT team or the CIO, because the CIO was not on the board. It wasn't deemed important enough. So it's a bit about integration. And we really promote, it's the people, the processes, and the culture all need to be integrated to safeguard and look after information, which really does start to address some of the concerns around people's personal data. And the health service itself has really been really working hard on that, to have this inclusive cybersecurity strategy. So it's all about training and education for those people utilizing the systems. One thing which you mentioned was really interesting and is going to be a real problem, and the UK is starting about how to address it, and that is medical devices. If you have a medical device which actually you use to measure how many steps you take during the day and just monitor your own blood pressure and everything else like that for your own use, that's absolutely fine. But as soon as it's then used by a doctor to start prescribing, it becomes a medical device, and therefore it needs a kite mark, a CE kite mark in the UK, for it to be designated to be a medical device, and therefore it has those levels of assurance and cybersecurity and integrity built into it to actually be a useful device to do so. Now, lots of people use lots of medical devices, and there are lots coming onto the market. But next year in the UK, all medical devices are going to be reviewed, and all will be re-kite marked to actually see What is a proper medical device? And by the way, how can we integrate that into our systems to ensure that patient data is preserved? And in the UK, we have this unique problem. Our NHS is a sacred cow, as we would say. It's been there since 1948. Everybody loves our NHS, but it's absolutely, you know, free at the point of delivery with unlimited demand. And consequently, keeping hold and understanding people's patient records has been really quite difficult. So post WannaCry, most of our trusts, our 225 trusts in the UK, have really been concentrating in getting their own house in order and then starting to move out into the ecosystems around those suppliers that support them. Not too bad during COVID if you were providing equipment, although we had problems with PPE, but much more difficult if you were providing services where information, personal data and information was exchanged. And that's when things really became difficult because of GDPR, because of these stretched lines of communication, which may not be secure because of using routers, which quite frankly were compromised. And so there's a whole rethink going on. COVID's forced us to rethink that a lot quicker than we were doing before, but we just don't see this as a technology issue. We see this as a business issue, effectively, the business of getting people well. So they come in sick, but they leave well. And then also joining up the patient record between primary care and secondary care, which has been really difficult to do in terms of the NHS and is vulnerable. But it's quite extraordinary that 25 years ago in the UK, your name and address and where you lived was in a telephone directory that everybody used and was available to everybody. And now we get so precious about anybody knowing our address, even our name. And we've sort of got a little bit, as a society, I think we get over precious about what personal data is, what's actually important personal data, and what is stuff which should be in the public domain to actually facilitate the use of services like the NHS and other things as well. So I think it's a really interesting dichotomy. I would say for us, a lot of our trusts are in a good place, but now need to deal with their ecosystem and how they actually interact with all those suppliers, especially people who wish to use and exchange data, not just here, but also abroad. We've got the Great Ormond Street Hospital, which is a famous children's hospital that routinely swaps information with the United States and with the Boston Children's Hospital. They're two very famous hospitals, but there's all sorts of interesting legalities now about swapping information with the US in terms of about safeguarding that information. And so there's a plethora of laws and rules and regulations which the technology and business need to rise up to meet to actually ensure that all can be done safely with the right protocols in place to ensure that data is looked after properly. And we create so much data on all of us nowadays. It's hard to manage, I think. And so I think COVID-wise, in this hybrid environment, there are some real questions. And you talked about enterprise architecture. Absolutely, I think there's got to be a lot of re-architecting of our security systems, but to meet the business need. And I think that's really important. Sometimes in our profession, we do tend to think it's the most important. And just lastly, in terms of cybersecurity, we have a government program, £1.9 billion, and a lot of the health sector cybersecurity is actually being funded directly through government, through the Cabinet Office, rather than the NHS itself, which I think is a very heartening and very positive place to be at the moment.
Thank you. Interestingly, I think even in addition to things reevaluating, an organizational's architecture, I think we're going to see changes in business models, and in the context of healthcare, how care will be provided. Which traditionally, again, you talk about brick and mortar. You get up, you go to a hospital, you go to a clinic to receive care. The notion of having constant potential distancing, where you can minimize contact by providing care remotely, is another area that will grow out. And for a lot of traditional organizations, that has been something that they have talked about and they've forecasted for. But now they've had to accelerate it, right? By the notion of keeping the foot traffic in the facilities increasingly lower, but still be able to provide necessary services. Obviously, there's always going to be cases where you talk about quiddity or chronic type of primary, tertiary, or secondary, tertiary care it's going to require people to be in physical buildings. But this notion of expanding those services outside the physical constructs of a building itself is overly important. And I think that is shifting the business model as it relates to healthcare. Now, on a similar topic, and this goes out to everyone, and I think we're gonna switch to financial services. Is what opportunities do we think exist for public and private sectors to cooperate in the healthcare space? I know Mr. Fitz, you had talked about some cooperation and data sharing, but what opportunities do we see now in this context to redefine the conversation, or to revisit, revisit conversations that maybe been on pause, or maybe throwing out the playbook a little bit and reevaluating, types of cooperation, whether we're talking about regulations or privacy-related laws, and just general cooperation between public and private. This is for anybody. It's a large question, I know.
So I'll go, and I think there's some interesting points there around data and data privacy. I think only Europe could take some simple principles around data security, enshrine it in something called GDPR, and then make something that's so difficult, complex to implement that you sort of lose the point of what we were trying to do in the first place. But that's perhaps a conversation for another day. I think maybe if you step back, what's possible is really down to will and requirement. There's so much that we could do. Simple example, a smart city of the future might enable an ambulance to automatically find where the patient is, for all the traffic lights to change, to get that patient from A to B as fast as possible. So that's then the city moving around the ambulance, and the ambulance being able to do what it needs to do because that data is there and it's connected and it's able. 5G is going to be a big step towards enabling that sort of thing. Smart cities are already in plan. I think what will stop us will be two things. One, our ability and willingness to share data and recognize that not all data is equal, and actually sharing data sometimes is more beneficial to all of us than trying to protect a little bit of data. And I like Andrew's analogy of the address book from 25 years ago. I think maybe some extremes that we have gone to with the likes of GDPR perhaps need to be reassessed with a common sense approach. And let's look at what we're trying to achieve, and then let's look at the right way to achieve it, and then let's make sure that we're doing it in a sensible way without being overly cautious needlessly in some instances. And I think the other point is funding and money. It's interesting in the UK how health sector is funded. I would say that as much as there is a lot of money available to improve cybersecurity, there's almost a very large amount of money wasted through inefficiency. If we could wipe out a lot of that inefficiency, if we could work in a more collaborative way, I would expect we would find that budgets suddenly do go further, that we can be a little bit smarter about what we do and how we do it. And unfortunately, the way our health sector is set up and is managed does drive inefficiencies in procurement, does drive inefficiencies in contracts. And actually, in some instances, if procurement are driven to make as many cost savings as they can, and they drive suppliers to be as cheap as they possibly can, well, what do suppliers have to do to make a margin? Well, they have to cut certain types of services or cut corners. So again, are we really applying a healthy dose of common sense to what we're trying to achieve, or is everybody working with their own blinkers on? This is my remit, and I won't try and think outside of it. So I think technology is going to enable us to do some fantastic things in the future. I think the willingness to maybe reconsider what's important in light of COVID, sharing information being at the heart of it, I think is something that is changing now. And I suspect it will take a huge push and effort from lots of different parts of the health sector industry to perhaps maximize some of the potential value that we could get if we shared data, worked a little bit more collaboratively, and recognize that sometimes the cheapest price is not the best price, and actually what's the outcome we're trying to drive.
Let me chime in if you don't mind, because this cross-industry cooperation is something that financial sector can help with based on that experiences we collected across various markets. We've seen this cooperation working at least three different layers. There is a cross-geography cooperation on the regulatory level. So we had great experiences with regulatory colleges, regulatory universities, during which we align with our regulators from across the globe to understand the requirements and create a sort of unified requirements that then help us to drive the adoption across the countries we are present in. I think the same can apply to the regulations in the healthcare industry. The second layer of cooperation is cooperation on the incident response layer. So whenever there are incidents that concerns the whole industry within the country or a particular group of companies within the country, financial industry built quite an efficient way of managing this kind of threats. And the third one is common infrastructure and the common information sharing platforms that, again, they go through the whole stack from the very contextual description of fraud schemas or malicious activities to something as low level as technical indicators of compromise that can be digested by the security staff of the respective companies. And those are all the lessons that are available to other industries, including healthcare industry.
Thank you. Any other thoughts on that last question? If not, I'm going to pivot a little to the financial sector.
Just one more comment.
Please,
it's like
please.
Almost on every cybersecurity conference, we are talking about exchanging information, exchanging data. The problem is like it's not so easy. If it would, we will not talking about it all the time. But I think that, yeah, the good news is like I can see like also on the European level we are learning how to do it, because when the CSAT network was first created, it was the huge hesitation to share information commonly, and we had like to dry run somehow before the COVID. It was the NotPetya WannaCry, and then we really saw that it's impossible. We built the infrastructure to do it, and right now during COVID it was working really well. Also with the private sector, which is like the huge applause for a private sector right now. But I think the real problem is like more in people than in technology. Like we can have the great technology which is support the information sharing and the great platform to exchange information. It's always to basic trust between the people. So this is something which really takes time and it's impossible to just do it. So I think that actually, of course, the law can help, but what you really need, you need the mutual trust, and that need the same people on the table, around the table all the time, that need time and knowing each other to really exchange this information and make this process working.
Yeah, I think just to back up what Magda said then, it was really interesting that during COVID, we had one of the trusts who had used contractors, private sector, to support the supply chain. And when the balloon went up and everybody was rushing around, one of the board members contacted the head of procurement, who was trying to integrate the private sector, and he said, "I'm not coming in. My girlfriend has told me I can't." And when they went to the contract, there was nothing enforceable in the contract. And one of the big things which has come out of WannaCry, looking at the supplier base, is that people have been using the same contracts for years. They just rolled over and rolled over and rolled over. And so many are just not fit for purpose to really outline what that private and public sector relationship should be and what's expected of people in times of difficulty. So I totally agree with Magda that we can go on about the technology as much as we like, but unless people adopt it, integrate it, and you have supporting processes, policies and contracts which support that, you aren't going to get very far.
Mr.
I wanted to add to this discussion about this sort of buzzword. I agree about the information sharing, because I can hear it for always, yeah. So that was always a discussion. But on the and I can easily agree that it is a sort of frustration when you hear again, and this is a sort of keyword for starting any collaboration and so on. But on the other hand, when I try to rationally evaluate the situation after years, I can remember 20 years ago we had a also technical standard for information sharing, which maybe some of you remember, like IODF, which is completely unuseful. Absolutely, it was only the sorry for saying that, academic works with the full respect to academic, but not always with the practical solutions. And nowadays we've got a sort of standard like MISP, which is very useful, and everybody uses MISP, yeah, you know, on daily basis. And this is both are for information sharing. So I quite often compare the situation to the same sort of frustration regarding educational things, awareness building things, which are always also, again, awareness. And my answer is, yeah, I can agree that this is empty words as long as we don't start to do some practical things. And we still will be complying about these things, but it doesn't matter, we should stop. Yeah, because there's no ground solution. Yeah, we cannot find anything which will be perfect. So this is ongoing work for always. So the same like developing the standards, good standards, which after years it seems to be quite useful and working like MISP is. I guess the same thing could be with awareness building, for example, and other things which we call sometimes buzzwords. So let's don't give up.
I love the optimism. I'm going to switch a little bit here. I'm going to go to actually Mr. Pekarsky. I have a question. This is in the financial space, and then it's open to anyone on the same question. But did financial institutions, in your experience, have shortcomings in their preparedness due to the lack of pre-pandemic digital transformation? Were there areas that definitely could have been? So I'm curious of your perspective.
Yeah, please continue. The short answer is I don't think so. So I was quite surprised by the quality of transition, the easiest of transition to the short-term solutions that we employed as an industry. A little bit looping back to what we discussed at the very beginning of the panel is that to me, again, the short-term solution is not a problem. We operate like this for like 3 months already, and with the outlook to operate like this for much more. The question that comes to my mind is more on whether we as an industry, and I mean security industry, not banking industry, we are ready to pay the price that we need to pay for the rapid digitalization in some of our areas. And I think that banking is in a quite good position, mainly because of the tough regulatory discussions that we had over the last years. Our regulators went almost full cycle from being very perimeter focused with you need to have your IT by yourself on your premises, kept in the basement, choose the position that we are now in which we can negotiate and have really fruitful and meaningful conversations around how we can build the stack, not only to be secure in the traditional meaning of this word, but also to be very resilient to the new categories of threats that we are facing, like pandemic, right? And what I can tell you from my view on the financial industry in the very broad scale is that those banks that engaged early into the conversations with their regulators around the adoption of some of the extended infrastructure, let's call it like this. I don't want to call it cloud, but more flexible ways of building your infrastructure, were in a very favorable position to scale up their infrastructure. Those operating on the markets that are more traditional and or maybe the ones that had a different digital agenda were experiencing problems, and this is where I think the risk really lies. The ones that made shortcuts, that made a kind of high risk appetite decisions around adoption of new technologies will need to pay this price, and the responsibility of their security teams now is to think through how they can secure this rogue IT or guerrilla IT in a proper way.
Thank you. Anybody else want to add any additional on that same question? I have another question on top of that, but I wanted to give everyone an opportunity if they wanted to add any additional insight or thoughts.
No, I think if you look at FS, life's easy. You know, they've got big budgets, they've got lots of capability, get all the new shiny technologies and tools. So, you know, kind of joking aside, I think what from talking to a few CISOs at a few big UK FS institutions or global institutions, but you know, it's the speed of change and then going back to make sure you've not put something out there that is insecure. So I think that rapid you know, find and fix is really important. I think what's interesting as well, and it's been referenced a couple of times just in general, is that tactical decisions that were made with a view to it being tactical for a few weeks, maybe a month, well, suddenly I think you'll find that they are now your strategic baseline, and you've got to move forward from there rather than having the opportunity to necessarily roll back. I think it will be very difficult now to roll back some of those what were tactical decisions. You know, I think FS probably was well placed because of the size of, typically the size of security spend that they have, you know, but I think the size and complexity of some of the organizations and some of the activities, you know, do necessitate people being in a physical office on a physical location, having 4 eyes, 8 eyes, etc. So, you know, I think there are areas where there might be some potential gaps in process that, you know, we're okay for a short period of time to get through the sort of the immediate response, but probably wouldn't suffice for a longer period of time.
And on that same theme, with the rapid sort of remobilization and operational readiness that a lot of the financial service was able to pivot to while maintaining, you know, particular security posture, are there other factors that you think contributed to that? Or is that just something that is inherently been built in over the years to FS, and this was, you know, something that, again, unprecedented, but it was something that, you know, could live within the existing frameworks, or was there some secret sauce that is very specific that allowed them, you know, at such pace to, again, maintain security posture while, you know, doing this remobilization and maintaining operational readiness? This is to anybody. It's not specific to. I mean, you can. Mr. Shannon, if you have a response to that, you can respond to that. But again, that's for everybody.
I think it's got to be the most regulated sector, and it's had probably the most scrutiny over the longest period of time. You would expect FS to be out in front when it comes to this sort of thing, or responding in the way that we saw. You know, I think broadly, I think FS probably dealt with it as you would expect. I think there might have been some question marks if, you know, if for years an institution had been saying, look, we're cyber secure, we've gone through CBEST, you know, we've done everything expected, and then suddenly there was some inherent problems that might have caused a few questions. But I think the level of spend, the level of budget, the fact it's very heavily regulated, financial fraud and financial crime have clearly been, you know, supersede cyber in many ways. So I think the sort of the mindset was also slightly different as well, would be my view.
Yeah, I mean, I totally agree with that. We work with 3 of the G8 banks, and banks have always been a target. You know, all the way back to the Wild West, where people were blowing up the side of a brick building to get in there, to get into the safe. You know, it's always been the most target. And you know, oddly enough, our laws are shaped like that. So if you steal money in the UK, you're going to go to jail longer than you will do if you murder somebody. I mean, so money has always been a sort of a prime resource that people wish to look after and invest in. As Sean said, you know, the banks have had squillions of pounds invested in them in terms of new fintech, and he said they always get all the new shiny toys and new ideas, and there's a lot of innovation in fintech as well, which there isn't actually in other sectors. So I agree with the majority of the panel. I don't think they've had much of a difficulty. I think there's one area of banking which probably has suffered a bit more, and that's been around investment banking and then asset management, purely because I just don't think, unlike high street banking, commercial banking, I just don't think they had quite as much money or felt the need to actually invest as much in that. And that's more around how they work corporately and how they're set up and the need for people. And also our laws haven't changed. So it's going to be interesting on laws. So we had a big debate in this country about people signing wills, and can you do it over Zoom? And is that, if you record it, is that going to be legal? And the answer is no. and still quite a lot of our laws require things to be signed in person. So I think there's a whole range of stuff that needs to catch up with the new hybrid way of working and the new model. But as Sean says, a lot of people are now going back, seeing what they did and what risks they took. And I think in some sectors, people have taken risks which, in normal circumstances would be deemed to be unacceptable. But, it may be re-baselined as the norm and the paperwork done afterwards, so to speak.
Just to connect those statements that was just made around the budget for security and some of the risks that we taken and we'll need to manage them over time. There will be an interesting time at the very beginning of 2021 when we'll hit the new reality of the shrinking budgets because of the macro trends within businesses, and attacks that will be more crafted towards those new technologies that we are now pushing through as a technology domains. I think that the intersection of those two trends, the less money we spend as an industry on security and the new category of attacks, plus the massive new uplift in the technology, the rapid shift in digitalization, we may end up in a very, very interesting situation in some sleepless nights.
So in our last 13 minutes, I'm going to ask again. I told you I would end with probably not a simple question, even though jokingly I was saying it was a simple question. And I'm going to give everybody 2 minutes to talk on it, but it's really to help wrap up everything that was discussed here today, and really let our audience walk away with an understanding from some lessons learned and really about healthcare and the financial service in the context of the pandemic and security as the larger wrapper. But ultimately, the question is, what lessons have both Poland and the UK have learned during the pandemic, obviously in the context of security, but more specifically in the healthcare and financial services. And what would you like to convey out to the audience in this context and as part of this extension of the continuation of this conversation that we've been having so far on this panel? So I'm going to start in reverse. I'm going to start with Magda. Put everyone 2 minutes on the clock, so I'm going to be very, very rigorous about this one. But Magda, if you could give your thoughts on that, that would be great.
So first of all, there were not specific COVID incident related to health sector during the pandemic. But I think what is interesting, you choose two sectors which are totally opposite to each other to this discussion. You have the finance sector, who is heavily regulated and really well prepared with all these shiny toys, and the health sector, which is not really good prepared, at least in Poland, but also in the other member states. What we saw with our cooperation with other CSIRT and international competence authorities in other member states. And what was really interesting was and really good during the COVID, in my opinion, it was we saw the situation that then you have the all hands of the on the boat, right? So actually the banks who are really good prepared in Poland were really willingly sharing their best practice with health sector to help them be better prepared. And also what, in my opinion, is very positive during COVID and the whole going online globally actually make real people understand that cybersecurity is important and you really need to invest, because so far it was only two reasons why someone would invest in cybersecurity. It was the law which obliged to do something, or the specific sector was such heavily impacted by the cybercrime, financial sector, that they must invest, right? Right now they understand it could be really good for them to just spend the money and invest in cybersecurity. I also think it's more, companies also more understand now how it's important to have the crisis management in place, for example, and how to connect this in cybersecurity with cybersecurity. And on the global perspective and European perspective, I think we are facing really interesting time at first, because the NIS directive review and the whole discussion which sector will be regulated more, because probably a lot of sector will have more regulation right now, even more than they had before, and also some new sector will be included in the scope because of what we saw during COVID. And also we have the new regulation and Digital Services Act, which will try to put so-called digital services in place, because right now we all see how important it is in the view of cybersecurity. And the third very important subject will be, of course, implementation of 5G. And I think the whole discussion we had last year before the COVID about the security of 5G and how to implement it in secure place. And a lot of sector didn't really understand how important it could be, and health sector particular, because like it is very visible that that will be one of the sector which will use this technology heavily. Right now, there is the common understanding that it is important, and we really need to focus on that. And the privacy, which is like, for me, it's a huge concern after COVID, and what will happen with all the GDPR regulation and our privacy as European citizens. Thank you.
Thank you, Magda. Samai?
Me, yeah. I will try to maybe stick to this gold-free triangle messages, which Magda started also from myself. The first of all, it is a really interesting discussion about the looking at the situation from the perspective of different sectors. But is it also so? My general, if I can advise, my general advice would be that let's try to learn as much as possible from the financial sector in terms of building the operational capabilities, but don't really be very strict regarding the strategy of the development, because it's completely different. Yeah, this is these sectors must be built on the different rules in terms of strategic development. That's my first message. And one remark about the sectors, because we put on the table two sectors, which is financial, health sector, but there are many others. And there is interesting thing, what is going on in transport section? Does anybody thought about the potential usage of the resources, capabilities, which probably are a little bit jobless, if I can guess, in this for obvious reason, right? So maybe this is also a good time to reconstruct, because maybe some things which we observe could be a long-term situations. So let's try to think globally on the strategic levels about other sectors, not only these two, because things are ongoing in all sectors, but differently. Yeah. Second thing is that what I already said, that we are probably in the sort of the rest time about regarding risks and ongoing attacks, and so maybe it's a good idea to spend this time on the good understanding of the situation we are now. Yeah, after all this, what has happened in the past, especially in the March-April period, and now to prepare for some things which we also discussed. Cesare said about what could happen in the next year. That's very important to really think about. And the third thing we a little bit just touch, because we are bored a little bit ourselves about the awareness thing, but this could happen, that it will be operationally a very important thing, because if we observe the vector attacks, it is for me quite clear now that a lot of the responsibilities are rebalanced into the wing of the end users. Yeah. Because they are in their environment, then are in the different environment. We don't cover with our monitoring very often the environment, so we really must spend more time on educating them. And to mix this with this second message, that could be also a good idea to think how important point and part of the whole incident management became the end user.
Thank you, Mr. May. Mr. Piparski.
Thank you. I will I will stick to the golden rule of three recommendations. So the first one, echoing what Mirek just said, is that we are on the calm waters now, and this will not last forever. So we need to use this time to have a reflection, and we can reflect on both what happened in the past, the technologies we adopted, the way we adopted, the way we responded, and I believe that almost each and every organization have plenty of different lessons learned from what happened, assuming that they were listening and thinking, and now it's a proper time to go through your notes, reflect on what happened, how you reacted, how you responded, to what extent you were ready to similar. You will be ready to similar situation in the future, or maybe a bit of different situation, because crises tend to evolve. So that's the first reflection. The second reflection that each and every organization should have is how the time of austerity that is inevitably coming to the majority of the sectors will impact the budgets, which puts additional scrutiny on how you spend your security, your precious security budget. Plenty of difficult decisions to come with mounting stack of new technologies and less money to secure them, while at the same time building up the resiliency capacity, which also costs. And the third reflection is that while getting ready for whatever is ahead of us, we should reflect on our digital supply chains. They move very counterintuitively, sometimes hectically, sometimes randomly, and I challenge that organizations really understand what's their digital supply chain, whether they understand all the dependencies in this maze of vendors and maze of interconnectivity. So reflecting on those three things, the past, how we reacted, and what the future, how we're gonna react in the times of austerity with very limited budget, and what is our digital supply chain and how to build resiliency to it are the key three takeaways.
Thank you very much, Mr. Sutton. I know we have reduced time, so I apologize for you and Mr. Fitz, but
I'll keep it really brief. So I think we've talked a lot about the threat, the risk, not on the negative, but just kind of the reality of what we've seen. What I would say is never has security had more time in the limelight than it has of recent. And I think we need to kind of carry that attitude forward. You know, it's not security says no for these reasons. It's no, yes, we can help, and here's how. We can enable users to work remote. We can enable users to be on their own device. You know, security really can enable the business to move fast and flexibly. I think it's really incumbent now on security people to recognize that, you know, we can say to the business, yes, we can, and we can make things happen fast. So I think real positive that security is definitely in the limelight for the right reasons at the minute, and let's try and keep it that.
Thank you very much, Mr. Fitz. Can't hear you.
Just two things for me. Digital plus cybersecurity equals fantastic business, and you keep your business going. And lastly, everybody's mentioned it, but we really need to revisit enterprise architectures, have an adaptive enterprise architecture that can meet any set of circumstances that can be thrown down at us, not just pandemics, but obviously attacks through cyber, changing business environments, changing in laws. We need to have that adaptive enterprise architecture at the heart of every business.
Thank you. And again, I really want to thank all of our panelists today for their time and their insight. I also would like to thank everyone who's attended today's webinar. Again, I wish everyone stay safe, remain healthy, and we should keep this dialogue going after this webinar in general. But again, thank you to the panelists, and I wish everyone the best and have a good day. Thank you again.
Thank you
very much. Thank you very much, everybody.